Hey everyone, welcome back to another episode of Career Tea. I'm your host, Saurabh, and today I'm excited to introduce a remarkable guest whose journey spans rigorous academic training, residency, and a specialized role in clinical pharmacy. Our guest is Laura Andino. Laura completed her Doctor of Pharmacy as well as her MPH, Master of Public Health, at Massachusetts College of Pharmacy and Health Sciences, a total of 8-year program. She went on to complete 2 residency programs, a general clinical residency at Tower Health in Reading, PA, followed by a cardiology specialty residency at Ohio State's Wexner Medical Center. Today, she works as a cardiology clinical pharmacist at Beth Israel Medical Center in Boston. We'll explore her path, discuss the residency match and preparation process, compare different pharmacy career tracks, and get practical advice for anyone considering this path. Laura, welcome to Career Tea. How are you doing today?
Hi, Saurabh. Thank you so much for having me today. I'm doing well.
Fantastic. I'm really looking forward to hearing from your story and hopefully give some insight to our viewers and listeners that might be following similar path as you. So let's dive right in. You spent 6 intensive years, Massachusetts College of Pharmacy and Health Sciences, to earn your Doctor of Pharmacy. You also hold an MPH. I want to know what initially drew you to pharmacy and how did your interest in public health shape your approach to patient care and your career path overall?
Yeah, so I think that my first introduction to pharmacy was when I was in elementary school. My grandfather lived with us for some time, and he was a very poorly managed diabetic, and I was the only member of the family that spoke English very well. So I would actually attend some of my grandfather's clinic visits with him. And at first, when we would go to the clinic, I thought that the person taking care of my grandfather was a physician, but it was actually an ambulatory care pharmacist, which is a pharmacist that specializes in taking care of patients in the outpatient setting. And it ranges depending on different disease states like heart failure or diabetes, which are some of the most common diseases that patients are managed for. And so it was through those interactions and then seeing how the pharmacist was really an advocate for my grandfather and teaching him about the medications, why you need to be on the medications, what's the safe way to use the medications. That was really my first introduction. And then I think that the Master of Public Health was also a really great experience because it took my training one step further in terms of being able to learn more about the different social determinants of health that play a role in the hospital setting and even outside of the hospital setting. So I was able to learn a lot about cardiac diseases as well that are impacted by social determinants of health, since that's my passion. And I think that that really just taught me more about what tools I can use to also be an advocate for my patient.
Well said. And so I want to touch a little bit on, your 6 years that you spent on getting your doctor's degree. I'm guessing that is a mixture of probably undergrad and probably graduate degree, right? Could you dive into that a little bit? Because I understand a little bit more and better on the business, I guess, side. But what did that 6 years involve?
Yeah, so there's a couple of different tracks for pharmacy education. So my track was actually an accelerated program. So as soon as I completed high school, I entered a 6-year accelerated pharmacy program at MCPHS University. What it comprised of was 2 years of undergraduate training and then 4 years that were graduate school, essentially. Some pharmacy tracks are 4+4, meaning that you do 4 years of undergrad and then 4 years of your doctorate of pharmacy. And then there are some programs that are even 5 years. You don't have any summers, just FYI, in those programs. And so in your very last year of pharmacy training, this is really your experiential training, meaning that you actually have the opportunity to go on rotations at different hospitals or different organizations to try and get more hands-on experience beyond the didactic training that you go through in pharmacy school.
Yeah. It's nice that I guess you got your passion from, from family essentially. So you automatically knew from the get-go that was kind of your path to go towards. But for, I guess, our listeners that might be starting out, maybe that don't have that calling for them like you did, what kind of mindset or skills would you say are essential diving into those undergrad studies or that career field overall? Because it seems like a demanding field, especially, based on the years of academic study that you have to pursue.
Yeah, so thinking back on my high school experiences, I did take a lot of different courses that were related to science. I took an advanced chemistry course during high school. But really, I think that if you're someone that's thinking about entering the medical field, you should try to shadow other individuals. It's something that does require a lot of collaboration and teamwork in one way or another. There are some tasks throughout the day that I complete very independently, but at the end of the day, if you really want to make sure that a patient is successful outside of the hospital setting, you have to collaborate with everyone on the team. I did have shadowing opportunities as well when I was in high school and then also in college. I think that one of the best resources is actually the admissions offices at universities. If you're someone that's curious but doesn't really know what a career entails, there are lots of students that sign up to serve, or you can even shadow them during their residency experiences as well, so you can kind of get a day in the life for them.
Was this, I guess, these shadowing experiences, this was when you were in high school, or when you're like in college, you can shadow, I guess, higher grade students?
So this was in both. When I was in high school, I had the opportunity to shadow some different physicians and different specialties that I was interested in, one of them being cardiology. But then when I was in college, I also had the opportunity to shadow clinical pharmacy specialists, which is the profession that I'm in now.
Was it your high school that kind of provided these opportunities, or is this something that you had to go out on your own and kind of be proactive to find these shadowing experiences? Or was it like your high school's like counselors that were like, hey, these opportunities exist if anyone wants to take them on?
So we did have academic coaches in high school that we would share our different career interests with, and then they would help us figure out what different universities offered, the programs that we might be interested in, and then different ways to find out more about those programs, such as reaching out to the admissions offices. But it was really a lot of self-initiative to try and reach out to different hospitals. They have different volunteer programs that you can sign up for. And through those volunteering opportunities, I was able to meet different physicians and different residents and ask them if I could shadow them for a day. And no one ever shot me down. I think when you ask someone to shadow them, a lot of people actually get very excited.
Yeah, they're probably like, I want to mentor somebody, teach somebody, someone's coming in my career path. Yeah, that's
Exactly.
exciting. So after pharmacy school, you went through the residency match process. I know very little about this, and I feel like a lot of people don't really know how the matching process works, because I feel like in different fields, it's a different process. So could you explain how that process worked for you, and also what applicants should expect when they begin applying for residencies?
Yes. Residency training is something that's not required for pharmacists, but if you are someone that really enjoys clinical pharmacy and specifically hospital practice, a lot of hospitals and institutions are now requiring pharmacists to complete at least 1 year residency training, so that you can get more hands-on exposure. So usually the way that it works is that once you're in your last year of pharmacy school in December, you start submitting all of your different applications to a portal that's called Forecast. And this portal is also used by people that are writing your letters of reference, and then also by the candidate that's submitting their letter of intent to the program that they're interested in applying to. And so you go through that process and you start hearing back from these different residency programs in January to set up interviews. And interviews typically take place anywhere between January and February. And then in March, I believe it's sometime during the second or third week of March, is match day. So you find out which program you matched with. And so the way that it works is that you end up interviewing at different institutions, and then you rank them based on your preference. But then the institution that you interview with is also able to rank you based on their preference. The system works in a way that allows for the candidate to more or less have the upper hand, or have the opportunity to match at the programs that they prefer, which is a plus for those of us that are applying. And so on match day, you find out where you matched. If you didn't match on match day, you still have the opportunity to go through a second phase of interviews where you're able to apply to other programs that maybe didn't fill all of their residency spots as well.
So if you rank your schools, let's say you have 5 schools, you rank 1 through 5, and you match with school 2 and school 4, right? You have the choice of choosing between either one, correct?
So you actually only match with one program. Each program that you interviewed with has the opportunity to rank you. And so if you're on their list, there is a chance that you would match at that institution, and vice versa. If I interview somewhere and I feel that it's not a great fit for me, I can choose to not rank them on my list, But if I do rank them, then there's a chance that I might match with them. And then once you match, that's pretty much it. There's no changing where you go to.
So are you interviewing one program at a time? Because what if you've interviewed with like multiple programs?
So
How could it be that multiple programs are like, yes, we want this candidate?
exactly. And so that's what ends up happening a lot of times is that a lot of programs, hopefully they'll find you interesting and they'll think that you're a good match for their program, but the forecast system favors the applicant. So if you have two programs that ranked you number one, but you ranked only one of those programs number one, most likely you will end up matching at the program that you ranked highest.
I see. And then whatever you match with, you only have one place that you're going to. So it's not like undergrad where you have multiple choices and you'll sit and think like, hey, should I go here or should I go there? Okay. So after, I guess, so in these residency applications, there's interviewing as well that goes on. How did you prepare for your residency interviews? And what advice would you have for if there's students right now that are gearing up to have these crucial conversations and interviews? What advice do you have for them? How they should prepare, what they should talk about?
Yeah, so I think preparing for my PGY1 and PGY2 interviews was a little bit different. But thinking back on my PGY1, a lot of these interviews required to do a 10 to 15-minute presentation. Sometimes it can be a patient case, so an interesting patient that you encountered while you were doing your rotations in the hospital. Other institutions require you to give a presentation on a specific disease state and talk about how you diagnose and manage a certain disease state, or what they call a clinical pearl. So maybe an interesting fact that you learned about a specific disease state. A lot of these interviews also ask different personality questions to try and gauge how you would work in a team setting or how you would even respond to different scenarios. Residency training can oftentimes be a very high stress environment. There are lots of times where you have to make a decision in front of a patient that's maybe not doing so well. Maybe there's a code blue or code stroke. And so trying to assess how you would respond to those different scenarios. And then it's also a lot about the candidate interviewing the program. So there are many excellent programs that exist, but it really depends on the candidate and the preceptors in the residency program to determine who is the best fit based on your goals. So some programs might have more transplant-focused residencies or exposure for a PGY1 resident, whereas other PGY1 programs might focus more on the ambulatory care setting. And so based on your interests, you can pick where you think you would have the best experience.
I see. So before I go to my next question, I want to ask you, what was your personal experience? Like, what was the things you were looking at when you were choosing your programs? And like, how many had you applied to, interviewed with, and what kind of drove you to your programs?
Yes. So for my PGY1 training, I've always known that I wanted to be a cardiology pharmacist. That was always the goal. So when I looked into a PGY1 residency, I was looking for an institution that was going to offer me a really broad experience, but also have lots of different opportunities in cardiology. I think a PGY1 residency really focuses on establishing a strong foundation for you so that you can be almost like a jack of all trades. So you want a program that's going to expose you to a little bit of everything, even if you aren't truly passionate about everything. And so one of the reasons why I ranked Reading Hospital as my number one program is because it was a large academic medical center. I knew that I was going to be exposed to lots of different patient populations in the ICU, in the general step-down units, and then also in the ambulatory care settings. And I had 3 preceptors in that that were cardiology trained. So for me, that was a big plus because I got to experience cardiology in an ICU setting, cardiology in an internal medicine setting, and then a specific niche of cardiology, which is focused on heart failure patients.
And that was in your first residency, correct?
That was for the first residency.
Cool, that's a great gap and bridge to my next question, which is, I want to understand the difference between your first residency and your second residency, which was at Ohio State, correct?
Yes.
And so my first question is it required to have 2 residencies, or is that something that you wanted to do to get more experience? And yeah, what were the key differences between the experiences that you got from your first residency to your second one?
So I think for hospital or institutional practice, a lot more organizations are requiring at least 1 year of residency practice. You do not have to do a residency practice. This is something that is optional after pharmacy school, or in other words, after obtaining your PharmD. So usually if you want to gain more hands-on exposure and clinical practice, residency is the approach that you would take. You do need to complete a first year of residency to be able to apply for a second year of residency, because the second year is actually focusing on a specific specialty. So examples of different specialties are pediatrics, solid organ transplant, emergency medicine, critical care, oncology. There's even pharmacy administration. There's ambulatory care, cardiology. There's infectious diseases. You could go on and on and on. But in your first year, you're really learning more about how to be the primary pharmacist on the team. So you're starting to develop those clinical skills to serve as the primary resource and as the drug expert. A lot of times the way that I explain my job to people that aren't so familiar with the medical field is that I'm the person that's kind of like the go-to resource for facts on medications. Which medications do we use for different disease states? And then which medication is best based on patient-specific factors and considerations. And so for your second year, you are now a fully trained pharmacist who has 1 year of experience under their belt. You've developed those essential skills in terms of how to collaborate with the team, but now we're actually focusing on a niche, and we're taking it a step further because in your first year of residency, you focus really heavily on guideline recommendations and then also different trials, but it's a little bit more superficial. Whereas in your second year of residency training, not only are you expected to be familiar with guideline recommendations and then also different landmark trials that have been published, but taking all of that information and then applying it back to the patient that's in front of you and thinking about how that patient in front of you is similar or different to the patients that were enrolled in different trials. It's really taking it a step further, especially with cardiology, because you have to think about the patient's anatomy and their pathophysiology and how different hemodynamics that the patient has might indicate that they're a better candidate for one therapy versus another.
At any moment during your residency programs, did you ever have a moment where you thought maybe you should have gone towards a different area of focus, or you were set and you knew that was your path?
No, never. So I actually had a bit of a non-traditional journey in terms of my second year of residency training, because I completed my first year of residency training and I stayed on board at my hospital. So I stayed at Reading Hospital for another year after my first year of residency training because they had a critical care staffing position that was open. And I was very intrigued by the high acuity and the ICU setting. It was something that really intrigued me. So I stayed on that year, which was great because I still had all of my preceptors around me. So it almost felt like I was doing a PGY 1.5 because they still coached me and trained me and mentored me a lot. But in that year, I found that I always gravitated most towards the cardiac ICU patients. And so that really solidified the decision for me that I wanted to specialize in cardiology.
Mm-hmm.
And my second year of residency training was the absolute best year of my academic career. It was so rewarding. And because I went from being a staffing pharmacist, so someone that's actually practicing, and then going back into residency and training mode, I knew that I wanted to pick the program that I was going to gain the most from. So I really didn't hold back in terms of applying to programs all over the country because I wanted to make sure that I was going to get the best experience.
Makes sense. Would you suggest that to other students to, like, after their first residency, try to take a gap and get some real experience before going to their second year residency rather than just jumping into the second year?
I think that if you are someone that knows what you want to specialize in, if you are absolutely certain and have no doubts, I say go for the PGY2 immediately after your PGY1 year. And that's actually what most individuals do. I think for me, there was still a question about critical care versus cardiology. And I really wanted to find a program that combined both. And I found that the Ohio State University Wexner Medical Center really did that for me, which is why I interviewed with them and selected them as a potential program to interview with that I was then very lucky to have matched with. But I think the good thing about pharmacy is that there's no one set path. You can really reach your ultimate goal with different.
Yeah, makes sense. So now that you're working as a cardiology clinical pharmacist, could you share your perspective on different paths available in pharmacy? For example, a role in clinical pharmacy, from retail pharmacy to pharmaceutical pharmacy. I hear these terms, but I don't really know what the, differences are between each, right? And I'll be honest, I recently learned that there is these different paths of pharmacy. Growing up, when I would hear pharmacy, I would think, you go to like a pharmacy in store or, at Target's pharmacy. But now I'm understanding that there's different areas that you can go into pharmacy. So could you shed some light on the different career paths and roles between those three areas?
Yeah, so there are many different paths of pharmacy. The path of pharmacy that I chose is clinical or hospital pharmacy. So these are pharmacists that work in a hospital setting. It can be inpatient or it can be outpatient. And as we discussed earlier, you can specialize in a variety of different disease states like cardiology or pediatrics and even administration. Another pathway is retail pharmacy, which, as you highlighted, is probably what most people think of when they think about pharmacy. So this would be your CVS, your Walgreens, your Target, and your Walmart. There are also some pharmacies that are independent pharmacies, so they aren't associated with any chain, and sometimes they're owned by different families. And so these pharmacies are more in the community setting, so they're meant to be able to dispense medications to patients. And you sometimes end up developing closer relationships with those patients since you see them most often when they come to pick up their medications every month. The other aspect of or path of pharmacy is called industry. And so this is more so associated with different pharmaceutical companies. There are a variety of these, such as Pfizer or Moderna are probably some of the different companies that most individuals have heard of. Sanofi Genzyme is another example. And there are a lot of different responsibilities, tasks, and specialties within industry as well. So you can be someone that specializes in education for different hospitalists and different members of the hospital team, where you give presentations and educational sessions on new medications that are coming out. And so you're really the expert on a lot of that trial data that maybe hasn't been published yet or has been published, and teaching different institutions how to incorporate the use of these different medications into their practice. There's also a lot of work that's done in developing these medications to begin with.
Okay, I hear you. So my next question regarding these different paths, I have two questions. The first one is there a difference or do you have insight on the career trajectories between the three areas? If there's a student right now that's deciding to go between the three, is there a career trajectory that one might take you farther or more opportunities per se? And I guess what made you choose clinical versus retail or industry?
I think that in either setting, there's always opportunity for career advancement, and it depends a lot on what your goals are as an individual as well. I can, of course, speak more to the clinical hospital side of pharmacy practice, since that's the path that I chose. And so for me, you start off as a clinical pharmacy specialist. You also have the opportunity to precept students and pharmacy residents. You also have the opportunity to work with management to add different medications to formulary, which is the list that hospitals use in terms of what medications do we carry in the hospital. There's a lot of education and teaching involved as well. So a lot of individuals that work in hospital settings are also assistant professors or adjunct professors at different universities. So if you're someone that likes patient care, but also likes to teach and get involved in universities, hospital practice might be a really good option for you. I think for the retail setting, if you're someone that is very, very organized, although you have to be organized for all settings, but someone that is also good with administration, that might be a better route for you, because in a retail pharmacy, there's usually just one or two pharmacists, and so you're really in charge of the whole store. Whereas for industry pharmacy, there's actually a separate pathway for that. So after you graduate from pharmacy school, instead of doing residency training, which is what I did, you do something called fellowship. And so that would expose you to a lot of the different career paths within industry, which unfortunately I'm not able to speak to as much.
Got it. You mentioned that the people that are more in the clinical setting, they might go on to teach at universities or schools. Do you think you'd ever want to go teach at a university or no?
Yeah, so luckily I had that experience last year during my second year of residency training. And so I was able to give 2 lectures at the Ohio State School of Pharmacy. And for me, it's a lot of fun because I get to bring my day-to-day patient scenarios to students that are learning it for the very first time. And I think it really puts you to the test in terms of assessing if you know the information well, but then also breaking down really complex scenarios into maybe smaller steps for individuals that are learning it for the very first time to be able to grasp and understand. I think that I enjoy having the physical patient in front of me and being able to interact with the team. I get more joy out of that. I also really enjoy having students and residents on rotation because while that also encompasses teaching, you're not necessarily giving a lecture anymore, but you're more so teaching in the moment and taking the patient vitals, labs, or, the reason why they came to the hospital, taking all of that information together and then making decisions for that patient that will hopefully improve their health journey.
Makes sense. I think you probably had like a good set of students in your lectures. I'm guessing if you enjoyed your time, because I know there's a lot of college students that can be annoying and could probably ruin your experience, but it looks like you had a good experience through that. So throughout your journey from pharmacy school to residency and into clinical practice, what would you say has been your biggest challenge? I know that from what you've been telling your story, you've enjoyed your path and it seems like you're passionate about what you've done. So I don't know if there's been challenges, but I feel like everybody in their journey has challenges that they have to overcome. So what's been like your biggest challenge that you can think of?
I think everyone encounters challenges in one way or another. I think that some of the challenges that I had throughout my academic career and then also residency training were work-life balance, trying to give 100% to residency training while also making sure that you're taking care of yourself. For me, it was a very fine line because, like you said, I am very passionate about pharmacy and especially cardiology pharmacy. I genuinely enjoy reading all of the new trials that are coming out and learning about all of the new medications. It's something that's a lot of fun. But developing hobbies is something that I've been able to do a lot more now that I'm no longer a resident and that my time is truly my time. I think another obstacle or challenge that many people encounter during residency training is imposter syndrome, especially during your first year of residency, because you are supposed to learn how to be the primary pharmacist on the team. So people aren't going to look to your preceptor for the answer. They're going to start to look to you for the answer. And nothing is straight out of a textbook because each patient is so different. And even if they have the same disease state, they're somehow very different. And so I think something that I always think about is that you are what you think and you are the people that you surround yourself with. And the hospital is a learning environment. So everyone is there to learn. Even the attendings are there and are still learning. So as long as you have that open mindset and that curiosity, if you don't know something, try to look into it. And then once you've done your research, talk to someone that has more experience than you and ask them about their opinions about what you found. I think that will take you very far.
Yeah. You mentioned that you have more time on your hand now, so you can focus on your hobbies, right? So I want to ask, since you brought up time, can you give a short description of what your day-to-day was like in your residency and then what your day-to-day is like now in your current job and I guess the main differences there?
So thinking back on my PGY2 residency training, which was 6 months ago, some of it changes depending on the rotation that you're on. And it varies because certain teams will start rounding earlier in the day than others. For the most part, last year, most teams would round at about 8 a.m. or 8:30. So I would usually wake up at 5:30. I would get to the hospital by 6:30 or 7 in the morning. and I would start working up my patients. The number of patients I had usually varied anywhere from 15 to 20 patients a day. At around 8 or 8:30 a.m., I would go attend rounds. If there was something that I was ever unsure about prior to going to rounds, that was my opportunity to reach out to a preceptor, give them a phone call, explain my thought process, and then have them explain their thought process and hopefully come with a plan for the patient. After rounds, I would then round again, but with my preceptor, because it's your year to learn. So I would then review all of my patients with my preceptor, and we would go through all of our plans. We would go through different disease states that I wasn't as familiar with and trying to help me grow clinically. And the afternoons sometimes varied as well. So we would do topic discussions. So if I was on my heart transplant rotation, maybe we would do a topic discussion on rejection or how to treat different infections, since transplant patients are often prone and at higher risk for different infections. If I wasn't doing a topic discussion with the preceptor, sometimes I would actually be in different committees, such as the interventional or the anticoagulation committees. And so a lot of those instances wasn't just pharmacy involved, but it was also medicine and nursing and maybe case management and trying to figure out how we can improve different policies and protocols at the hospital. If I had a learner on rotation with me, then a lot of my time would also be spent mentoring and precepting that student and maybe giving topic discussions to that student and do layered learning. Other aspects of my residency training included projects and research. So I would spend my afternoons working on data collection, patient collection data as well, working on different presentations that I would have to give throughout the month.
Nice. I think that from everything that you just said now, I think a lot of listeners that are in your path, they can take a lot of advice away from it too, because from the sound of it, you were involved with doing a lot. You know, I feel like you were always trying to like learn and expose yourself to like different areas. And I feel like that's a good thing to do if you want to kind of succeed in that field and kind of go forward. My next question is, if you could go back in time, which you might not have an answer to this, but if you could go back in time, what would you tell your younger self to do before embarking on your journey? And maybe there's nothing, because maybe you had a good plan, you stuck to your plan, and there's nothing you would change.
I truly am very happy with where I matched for my first year of residency training and my second year of residency training. I matched with my number one programs, so I was thrilled, and I had the best experience in both of those programs. However, during my first year, when I was applying for that first year of residency training, I think something that I would have done a little bit differently would maybe to have been more open-minded in terms of location, because something that's unique about pharmacy is that, like I said, residency training is not something that's required, but if you choose to do it, you can do it for 2 years. It's a little bit different from physicians who go to medical school, then they do an intern year, and then they have 3 years of residency training, and then they have 3 to 4 years of fellowship training. So we're talking about anywhere from 7 to 10 years of training after medical school, so they have a lot more time. Whereas for pharmacy, you only have the luxury of having 2 years after pharmacy school to have a huge group of individuals focus on molding you into the best clinician that you can be. So that being said, I would encourage people that are looking into residency training to just keep an open mind and try to select programs that are really going to shape you into the pharmacist that you want to be and give you the experiences that you're looking forward to having, because you can only do it once.
Yeah. If you were to go do a different location for your, like, I think you said your second residency, right?
From first.
Your first. Do you have an idea of where else you would have chosen?
I think I really enjoyed my time at The Ohio State. It was a very, very large academic medical center. They had more specialties than where I completed my PGY1 training. So in that aspect, maybe I would have enjoyed also having completed my first year of residency training at The Ohio State.
Got it. I was going to say maybe you wanted to go to maybe a school with better football team, maybe Penn State.
I think Penn State won the championship this year.
All right, you're right. All right, so my next question, kind of diving into a few fun questions here. What would you say it's one thing about working as a clinical pharmacist in cardiology that might surprise someone who's only seen, retail pharmacy, which I feel like it's majority of people?
I think something that's a little bit funny and that maybe a lot of people in retail pharmacy wouldn't expect is that I actually don't see a lot of medications. So when you're a retail pharmacist, you have to open the vials and make sure that the correct medication is in that vial, because then that is ultimately given to the patient. Whereas I'm a clinical pharmacist, I'm not actually checking those medications. I do verify orders for medication on our database, and I make sure that different things like the dose, the route, and the frequency of the medication are appropriate, but I'm not looking at the physical pill. And so that's one aspect that I actually miss from retail pharmacy. And whenever I do get to look at the medications, it's always a little bit fun to see the different colors and what they look like.
I see. Okay, yeah, I'm learning so much now here too, because I'm part of that group of people that's only like, when I've gone to pharmacy, it was retail pharmacy. So next question is, can you remember or share a lighthearted or unexpected moment from your residency or even your current role that kind of gives you, the reassurance, the pleasure that, I am here, I like where I am, and kind of like reaffirms your passion for what you're doing?
I think the most rewarding experiences for myself are one, when my patient is grateful for the way that I've helped them, and when I can visibly see their happiness when they're actually starting to feel better, especially if they came to the hospital feeling very sick, which of course, if you're in the hospital, that's usually the case. But being able to see them get better is something that brings me a lot of joy. But I think more than that is when I'm able to take a student or a resident on rotation with me, and initially they're not too sure about what they want to do. They're not even sure that they want to pursue hospital practice, let alone cardiology. And then having them for a month with me, and at the end of the rotation, them coming back and saying, hey, I want to apply to residency, or hey, I want to be a cardiology pharmacist. There's just no better feeling in the world.
No, I agree, and I hear you on that as well. My last two questions, next one is kind of fun as well. I asked this for my viewers and listeners, but also for my own benefit as well. Is there a favorite book that you have, or a book that you would recommend to other people to read? Maybe it's something that's helped you in your career path, or something maybe that you enjoy reading that's not really related to your career?
Yeah. So that was a good question, because I do read a lot of books related to my career, but I think another book that I've really enjoyed is this book. It's called As a Man Thinketh by James Allen. And this is actually a book that my father recommended to me when I was in high school. So he works in the business environment. And so for him, self-motivation is something that's really important, and it's something that he tried to coach me on a lot as I was growing up, and even all throughout college and even now. And so I think that big takeaways for me from that book is that you are what you think, you are who you surround yourself with, and then you are what you listen to. And so going back to our conversation earlier about the imposter syndrome, I think a lot of the ways that I was able to overcome that is by trying to surround myself with the people that had already achieved all of the things that I want to do and that I want to see myself doing in 2 to 5 years. Able to do that, you really end up going a long way.
I like that advice, and I like your dad's suggestion of the book. I'm going to add that to my list of books, and I'll be reading it soon, so I'll tell you my thoughts on it as well. Before we wrap up our conversation here, you've shared a lot of advice for, younger people, students, or even people that might be early in their professional careers. But if you could sum up your advice motto in 1 to 2 sentences for students, what would that be?
I'll do it in 2 words: just ask. So I think a lot of times if you're curious about something and you don't know where to start, just ask someone. So I think starting with admissions offices at universities that you're interested in applying to is a great way to start. They'll connect you with more resources like different students, even students that are in the program or that have graduated from the program. It's a good way for you to network and shadow. Listening to podcasts such as these is also a really good way to learn more about pharmacy practice specifically. There's 2 organizations, the first one called the American Society of Healthcare Pharmacists, and then the American Clinical College of Pharmacy. These are 2 organizations that are very popular and that can teach you more about what the role is of a hospital pharmacist as well.
Thank you for sharing that. Laura, thank you so much for sharing your incredible journey, very intensive academic training and residency experiences to your specialized role today as cardiology clinical pharmacist. I'm hoping that your insights into residency process, the varied career paths in pharmacy, and the lessons you've learned, are truly invaluable. And I'm hoping that our viewers and listeners can take something away from it and maybe even follow in your footsteps. And hopefully, maybe in a year, 2 years, we'll have you on again and kind of see how your career is evolving and get more insight into what you're doing then.
Sounds great. Thank you so much for having me today.
And that wraps up the episode of Career Tea. If you enjoyed our conversation, please subscribe if you haven't, hit the thumbs up button, and leave a review as well. Share this episode with anybody. If you have friends that are in the same career path as Laura and they might take something away from this episode might help them make some decisions. So share this episode with them. And again, if you have an idea of a industry or a career that you would like to hear from the professionals from, please let me know, leave a comment down below, and we'll try to find people in that field. Thanks for tuning in, and I'll catch you guys again next week.